Welcome to LollieTasking. I invite you to join me and other amazing and inspiring women discussing our passion, work, discovering our purpose, interesting topics, and how we seem to have it all together. I hope we can motivate you and show you you can do it too, with some planning, a little bit of balance, and a dash of determination. This is LollieTasking. Hello, LollieTaskers. I am your host, Dr. Lola. I am very excited to have on this monthly series, Afropolitan Health on LollieTasking. On these episodes, as previously discussed, we dedicate the entirety of the show to a health topic that I believe will help us renew our body. My hope is by the end of the show, we would have educated you, empowered you, and motivated you to take action on your health. So today's show is dedicated to heart health and prevention of cardiovascular diseases. Why is this important, you may ask? Heart health is the number one cause of death for Americans and highest in the Black versus other ethnic groups and whites. Various quotes online I looked at said the percentage could be anywhere up to close to 48% of African American women and 44% of African American men have some sorts of cardiovascular or heart disease. And this is regardless of socioeconomic class when compared to our other counterpart. We still have the higher rate. So we need to discuss this. We need to talk about it. We need to go ahead and start decreasing that rate. So I thought, who else to help me discuss this important information, if not better than Dr. Tracy Paul, okay? Dr. Paul is a cardiologist. She specializes in both general cardiology and critical care cardiology. And she's also a cardiac echocardiography imaging. I know she does a lot. She is also an assistant professor of clinical medicine at Weill Cornell Medicine. When she's not saving lives, she's enjoying her time with her wonderful husband and her 10-month-old son. With that being said, we welcome Dr. Tracy Paul to the show.
Hi, thank you for having me.
Thank you for coming. I appreciate you coming. I think people will definitely learn from you about this. So with that being said, can you tell us a little bit about yourself and your journey to becoming a cardiologist? So basically like how you came about the specialty, why it's important.
Sure. I grew up in the Bronx, and where I grew up, there weren't that many like doctors of color, but like luckily my pediatrician actually was a Black man. And then, so that kind of made me see from a young kid that, Black people, that we can be doctors too.
Right.
That I participated in a kind of a few like pipelines into medicine programs actually at Weill Cornell. And then fast forward when I got into medical school, what really attracted me to cardiology was the physiology of the heart and just how like the heart worked and how, it kind of just made sense, like intuitively, how everything flowed through. And then when we got to pathophysiology, what I loved about cardiology is even though the heart can fail, needing to get transplant, things of that nature. We have so many therapies to offer cardiac patients
Right.
that I felt that, that I could help people. And ultimately that brought me into cardiology. That made me interested in cardiology. And thankfully, like through my residency, it helped to strengthen why, I wanted to be a cardiologist. And I'm glad I made the choice because even at the end of some very long days, like it just pops into my head, like, I'm glad I do what I do,
Right.
and I like my job.
That's awesome. So to you, what would you consider, like when people hear heart health, everybody has different things they think about. As a cardiologist, what is heart health to you?
Sure. A healthy heart to me is one in which, that you have, that your numbers are controlled, meaning like your blood pressure is in the normal range, your cholesterol is in the normal range. But more importantly, like this heart is able to get you through the day where you're able to do every task that you need to do, where you're able to exercise if you like, and that you don't feel any major negative symptoms.
Mm-hmm. So, like you measured, your numbers are good and being able to exercise. I think it's very important that, yes, our heart is the most important muscle that we have. It
Hmm.
starts from when maybe a couple weeks or 4 weeks during conception to basically the day we die. And it's important we really take good care of it. What are the things, I know you mentioned number, what are some of the things you think like we need to focus on from not only a healthy standpoint and maybe also a medical standpoint that the general population needs to be thinking about when they think about their heart health?
So I think one, for us, we need to stop thinking that like that our blood pressure, that it's fine if it's like 140 over 90, if it's
Mm,
like 150 over 90. I meet a lot of people, they're like, oh yeah, every time I see the doctor, it's a little bit high, but it's just a little bit high. And I think it's only high because I'm seeing the white coat. Like a lot of people in
right.
the general population think that they suffer from like white coat hypertension.
Mm-hmm.
Um, and to that I say, okay, it's one thing if one reading is like that, but like when I look back in a chart, if every doctor you've seen for the past year, your blood pressure is over 140 over 90, it really should be a discussion about getting you either on blood pressure meds or
Mm-hmm.
having you lose significant amount of weight to
Right.
see if that will correct the blood pressure. Because I think, we're kind of underestimating the effects of this like mild hypertension and what it has
Mm.
on the heart long term.
Why do we think, I mean, we both know, but for the general population, like, why do we think that hypertension is so significant in affecting the heart? Just so people understand why it's important to make sure we have the blood pressure at a good rate.
So, when you have high blood pressure, the heart just has to work harder. And also, like, people who have high blood pressure, unfortunately, those are the same people who usually have other diseases of the heart, such
Mm-hmm.
as like high cholesterol. There are also people who are more at risk for developing diabetes. And all of this can lead to buildup of like fat and plaque in the arteries of the heart. And so it's just important for people to realize that, I think a lot of people kind of downplay how important high blood pressure is
Right,
because
right.
they have so many people in their family and their friend groups are on pressure medication. But it's something you need to be aware of and something you need to be
Mm-hmm.
trying to correct.
Yeah, I tell my patients all the time, like having high blood pressure is basically like you trying to push against a closed door all the time, right? So
Yeah.
your heart is pumping, the blood pressure in your circulation of your body is super high. And if your heart has to push against a closed door all the time, after a while it's gonna get sick or get tired or not
Hmm.
even be able to function the way it's supposed to. Besides high blood pressure, another thing you mentioned was obesity. Like, why do you think obesity also contributes to like heart diseases?
Sure. So when people are on the obese side, they build up what's called like insulin resistance. So
Mm.
the amount of insulin, which is very important in the controlling of sugar levels in the body, it can't really do its job, because it's just too much of a body to kind of serve.
Right.
And so when you see this buildup of insulin resistance, that leads to diabetes. And as we know, like persons who have impaired like sugar handling, that they're also more likely to end up going on to develop like a coronary artery disease,
Right.
meaning disease of the heart. So obesity plays a role in that. Obesity also plays a role in high blood pressure. Like there are studies showing, that if you're able to lose anywhere from like 10 pounds or so, you could see about like a 5 to 10 point reduction in resting blood pressure as well. Because once again, when you have a bigger body, you're gonna have to have the heart working harder
To
to pump
push.
to meet, yeah, to push and meet the
Hmm.
demands of all that size of the body. And then also people who are obese, they're more likely to also have high cholesterol as well. And part of
Hmm.
that could be the diet, like the high fatty diet that's keeping on that extra weight. I'm not saying that, obesity just across the board means that you're very unhealthy or whatnot. Like they're all of us have certain different body types. But in
Right.
general, the way things are going now, in modern society, a lot of us we're sitting too much. We're taking in too many calories,
Mm-hmm.
and we're kind of living a lifestyle that the human body wasn't really designed for. And
Right.
as a result, we're developing heart disease.
Mm-hmm. I totally agree. And while I do not think everybody in the obese range, because I'm sure if you did my BMI, probably fall somewhere in the lower obese range or not,
Hmm.
because we all have different body types. But when you
Exactly.
start getting into the morbid obesity, I totally agree that not only does it increase your lipid levels or your cholesterol levels, it increases your blood pressure, it increases insulin resistance, which I believe, and I'm gonna get to this with you, are some of the lifestyle risk factors that can increase
Hmm.
your heart health or heart condition or have you have coronary artery disease. What other things besides those three things do people need to be aware of that maybe they can work on or change in their lifestyle to help them out?
Oh, sure. So a huge thing that we all can work on is stress. Okay. So stress, especially for women, is a big contributor to heart disease. And so when we talk about stress, not just being in a stressful job or a stressful like a home situation, but also just not doing simple things like getting enough sleep is stressful to the
Mm-hmm.
body.
Mm-hmm.
And there's even like some diseases of the heart, like weakening of the heart, that is associated with stress, and we call it stress cardiomyopathy, like Takotsubo.
Mm-hmm.
And that's something that's not it's not very common, but if it does happen, it happens mostly in women. So I
Right.
implore women to really, you need to think about some time in the day or in the week where you can just kind of like take a break, maybe meditate, maybe go for a
Mm-hmm.
walk, whatever kind of like lowers your stress burden. Try to practice that at least once a week, if not several times a week, to kind of bring you to a better place. Other risk factors, a major risk factor is smoking.
Mm-hmm.
Um, Tobacco use, we've known for decades that definitely increases one's risk of cardiac disease. And also smoking also affects women more than men. So female
Right.
smokers are more likely to develop heart disease than male smokers. Another huge risk factor that's especially pertinent to the Black community is family history of coronary disease, of heart disease. So, in some of our families, we're maybe not that open about our health status. We may not know that our grandparent had like a heart attack because they may be ashamed and have hidden that. We may not know
Mm-hmm.
that our own parents have had heart attacks. But these are things we need to know, because then that makes us know that we're at increased risk for developing heart disease, and that at a younger age we should be seeing a doctor and we should be having some sort of risk assessment done, so that if we need to make some lifestyle changes, that we can implement them early so that we can perhaps prevent developing cardiac disease, heart disease.
Yeah, I totally am with you on that. And I tell people that's why it's one very important you see a doctor regularly. Don't
Mm-hmm.
wait till when you have chest pain or you can't breathe before you see a doctor. If you're seeing your doctor regularly, your doctor would have asked you some of these questions that will help bring out some of that risk factors. Sometimes when the doctors ask you questions, a lot of times not like we're trying to be nosy, to be honest, y'all. Like we're really looking through some of those risk factors. Like when we come to you, we're not going to say, now we're going to ask you about risk factors for heart disease. We're just going to be talking to you and say, oh, so how's your mom? Is she sick? Do you have anybody that has this? It is very, very important that you're very honest with your physician about your family history, about your personal history, about your social history, even things like, doing drugs. Let me tell you
Mm-hmm.
guys, yeah, I have heard anything you think I'm gonna be shocked about hearing. I've probably heard way worse than that.
Yeah.
I've heard way worse than that. And just be honest with your physician. If you told your physician, for example, like maybe you do cocaine, we
Yeah,
don't
we need to
encourage
know.
it, right? But we need to know, because now that we know you do cocaine, if you tell us you're having maybe musculoskeletal chest pain, while instead of us blowing it off, we're like, it might be an atypical, you know, heart attack. Let's go ahead and just get an EKG just to make sure. So you have to be very, very honest. I I'm just going to summarize what Dr. Paul said again. Smoking, numero uno. I know it's hard. Try, 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 try. Can I say try one more time? Try hard to quit smoking. Get whatever help you can. Family history is very important. Obesity or trying to lose weight. Another thing that's hard. Sure, I'm still working on mine too. Uh,
Yeah, same here.
um, having high blood pressure. Do you even know what your blood pressure number is majority of the time? Not trying to get to that borderline. Try to get it to a normal range and do what you need to do to get to that normal range. Some people may be asking, like, is there a test? Because people are always looking for that fast. Is there a test to check my cardiovascular head, quote unquote, or predict if I'm going to have heart disease?
Yeah, so once you're pretty much over the age of 20, you should be seeing, like, as you should have been seeing as a child, a doctor at least once a year. And so when you get over the age of 20, we start to do some risk assessments. And they become more frequent as you become older. And so some of the tests that we'll look at, so like one, we'll measure your blood pressure every time you come. We'll also look at your heart rate. Then at certain points throughout your life, we'll screen you for diabetes. We'll also screen you for high cholesterol. Using these numbers, we can help to generate like a risk assessment. So one of the risk assessments that we use in cardiology kind of generates like a percentage, like a prediction of possible development of heart disease in a 10-year span. And then there's another risk calculator. You can look at someone's 30-year prediction for possible heart disease. I say this, but at the same time, we need to understand like how these risk calculators are made and like what data is used. So one of the huge issues with the risk calculator when it first came out is that they felt that it really didn't estimate risk well, especially in Black men. And so, while I use the risk calculator to kind of help guide me, I also individualize it for the patient based on, the patient's family history, because that's another thing. A lot of these risk calculators do not take family history into account at all. So for me, I really look at the family history. I look at your like activity level. And I look at also, aside from just like smoking, like what other sort of deleterious like behaviors are you involved in? And then I also look at, and especially for women, things that are not accounted for in the risk calculator is, what happened during pregnancy? Like, did you suffer from high blood pressure during pregnancy? Did you have diabetes during pregnancy? These are things that we know now definitely increases one's risk of developing heart disease later on in life. Also, another big thing, did you have preeclampsia in pregnancy? And sometimes it really takes teasing it out, talking to the patient, because they may not have understand the reason why they had to deliver the baby early is because they actually did have preeclampsia, So I think taking a pregnancy history, that's another thing to help us assess risk. And then also other things that people are not aware of, like if you have some of these like autoimmune diseases, like thyroid issues, lupus, some of these connective tissue diseases, all of these things increase risk of heart disease in both men and women, but women are usually more affected than men because we're more likely to have these autoimmune disease, and especially Black women. There are high rates of autoimmune disease amongst us. So, those groups, I really try to stress that, they should have some sort of risk assessment. And, they should also, that the rules that we're using now for who should be on like a cholesterol lower medication, we may need to adjust if you're in these like high risk groups and not just go by a number.
You talk about a lot of this being higher in women and specifically African American women. And we kind of talked about it earlier in the show, how, heart disease is significantly higher in African Americans slash Black, so people of African descent. Why do we think that is? What is the research that kind of backs that up? What is the thought process in the cardiology community about that?
Sure. So, high blood pressure, it's more prevalent among African Americans. I think African Americans have some of the highest rates of high blood pressure throughout the world. And people are really postulating that there's a difference in the way persons of African descent handle salt in terms of with their kidneys. And so that makes us a lot more salt sensitive. So, some of our counterparts in other racial groups, they're maybe able to eat a higher sodium like food and not have the same amount of blood pressure increase. So for us, like blood pressure, I think is really number one and what really increases our risk of heart disease. Another issue is like we had mentioned before earlier in the show is just increased like body weight, while BMI is a little bit helpful, I too recognize the limitations. But, looking at some of the data right now, it's estimated that about 3/4 of Black women are in either the overweight, obese category. And that's
wow.
2/3 of Black men, And while, like you said, I don't necessarily agree that everyone who like falls into that range is like unhealthy or whatnot, because we all have like different like body types. It's just something, we need to pay attention to. And, maybe we need to make that effort to lose about like 5-10 pounds. Because I tell my patients, even if you lose 10 pounds, you're going to see some reduction, in the blood pressure. You're going to see some improvement in the cholesterol. So, it's just like baby steps.
Yeah, I agree with just taking those baby steps, because people always think that, oh my gosh, I have to do this. Even if you just do one thing, right?
Mm-hmm.
Okay, I'm gonna be more active. I'm gonna
Yeah.
start parking the car like 2 rows down when I go to the grocery store. So I'm gonna take the stairs when I get to work. That helps. And then when it even comes about salt intake, if you have a high blood pressure, you don't have to overly salt everything. You just salt a little bit to taste. Like all those little things, when you add them together, it all matters. And also, like with obesity, like you don't really, yes, maybe ideally you want to lose 50 pounds. Why don't we start with five?
Exactly,
you know?
exactly. Just start with 5 pounds, Like don't
Yeah,
think about, oh, in 2 months I would have lost 20 pounds. Like
exactly.
you're probably not gonna meet that goal,
You may have gained 20 more. Try to lose
Exactly.
20.
Yeah, you gotta take it
Excuse me.
easy. And
Oh
now
my
you bring
God.
up a good point, like with the salt. Like I tell my patients, don't add salt like to your food once it's cooked. Like when you're cooking, like that's fine. But like sometimes like you'll go to a restaurant and people are actually like salting French fries. Like French fries already have like a ton of salt because
Oh,
they're salted before they leave the bag. You shouldn't add more salt to that. And it is kind of like modifying our taste, but and also recognizing like some of the seasonings that we cook with, you need to check the label because it may
that's
say
so
like
important.
garlic and onion like seasoning, but you may look and it tastes good because it also has salt.
Mm,
Or like lemon pepper also has salt. Or a lot of these things like Lori's or like these bouillon cubes and Maggie. I mean, growing
right.
up, like this is what a lot of people like I know have cooked with. But
Mhm.
as I get older, I realize, like I need to change that because high blood pressure does run in my family. Diabetes runs in my family, and so I need to be cognizant of all of that.
Right. Right. That I mean, no matter how much we love. I mean, I'm Nigerian. Everybody knows that probably by now. And we love our Maggie cubes and our seasoning, and we want to over season and all that. But once that's done, I totally agree. There is no need to be adding an additional salt because it's not as salty as it should be. Because by that
Exactly.
time, all you're eating is salt.
Hmm.
Uh, but I'm sure a lot of people, like when they think about cardiovascular health, the only thing people really talk about is heart attacks. You
Hmm.
know, and can you talk a little bit about one heart attack, how it presents generally, And there's this talk about atypical presentation of heart attack
Sure.
in women and how it's important to recognize those issues. Um, and then also, if you do have it, or if you do think you have heart attack, what should you do next? Or
Mhm.
having a heart attack, I should say.
So, the number one symptom for both men and women having a heart attack is chest pain. Okay. And a lot of the times with the chest pain, we'll ask, is it worse when you're walking? Is it relieved by rest? How long does the chest pain last for? Does it go anywhere, like up your neck, down your left arm? So chest pain is number one. But we've noticed in women that sometimes women present, not sometimes, a lot of times women don't present with this classic chest pain, okay? Women sometimes just mention that, I've been feeling more short of breath recently, or I can't really walk as far as I used to. Another complaint that sometimes we'll hear from our female patients is, I just feel tired, like
Mm-hmm.
extremely tired, a lot of fatigue. Sometimes like acid reflux can masquerade as a possible like heart attack. So,
Mm-hmm.
it's very important to like recognize your body if you're feeling if you have elevated risk for heart disease, like if you're a person that has like high blood pressure, diabetes, cholesterol, all these things that we've been talking about, and you start to feel a change in general, you need to come in to see your doctor. In certain instances, if you know you're feeling very short of breath, if you have new chest pain, um, you just need to call 911 and come in, because what we know is that if you're having a heart attack, the time that it's diagnosed is very important, especially in certain
Right.
heart attacks, severe ones, because then we're able to open that vessel back up and stop the heart attack and help to save the muscle of the heart.
Can you describe to people what exactly a heart attack is? Yes, they say, "Oh, I'm having a heart attack," like, but I don't think people really understand like the idea of coronary artery disease and why you are having a heart attack. Because I feel like sometimes when people know the why, then they know the why they should do what they need to do.
Sure. So when someone is having a heart attack, basically blood flow is cut off from portions of the heart. And so blood is very important to the heart because it carries oxygen. And so those cells of the heart, they're not receiving oxygen when you're having a heart attack. And so that's why you see pain. That's why sometimes people can start to develop strange like heart rhythms. Sometimes because of the disruption of the oxygen to the cells, that part of the heart can get very stiff, and then you can see backup of like fluid and blood into the lungs, making it very difficult to breathe.
Mm-hmm.
So really the main thing is a heart attack. It's like part of the blood vessel is closed off. So sometimes the blood vessel can be partially closed off. Sometimes it can be completely closed off. So when it's
Right.
completely closed off, that's definitely an emergency, because if it's not reopened, that part of the heart can die. And as you know, like if you don't have a muscle that can be used, you're gonna well, not I don't want to say like that, but like if the part of the heart muscle dies, that pumping activity that the heart does, it can't do it as well. Okay.
Right.
And so that's going to lead to a lot of major downstream effects. So the main thing with a heart attack is to realize it's like the blood supply to the heart is being cut off. This is an emergency and I need to get this addressed.
I totally agree. Like the way I explain it to, because I deal with kids, in case people don't know, the way I explain it to the little kids is that the heart is, if I may say so myself, is the most important muscle in the body. It's the most important muscle in the body. And just like, the pilot is the most important person on the plane, you got to make sure the pilot is doing well. If the
Mhm.
pilot is not doing well, the rest of the body cannot do well. Okay. So the heart is important. So we got to take care of our heart. So like Dr. Paul has just mentioned, like the vessels that feed the heart has to be taken care of. So how do we take care of those vessels? We're not like physically walking over and taking care of them is by eating healthy. When we
Mhm.
eat healthy, the vessel doesn't have a lot of cholesterol or fat hearts to like block the vessels that goes towards the heart is by exercising. When we exercise, the vessel is feels a little bit stronger, actually a lot more stronger. Just like when we run, when you run, you have that endorphin or you feel really good. You can imagine how your heart feels when you exercise. When we don't have diabetes, like all those things help take care of the pilot of the heart of the body, which I think is the heart. The neurologists disagree with me, but I think it's the heart.
Spoken like a true cardiologist.
Okay. Oh my God. All right. So for people that have been listening to this, hopefully they're like, oh my gosh, I really need to know certain things about me. Like, what are I know we mentioned blood pressure. What are like four things you feel like everybody should know about their health that would help them make good decision about their heart?
So I think one, you need to know like your blood pressure, like what your blood pressure typically is.
Right.
I think other things to help other things you need to know about, like some people, like when we're eating a ton of meat and a lot of carbs, but we're not eating any like vegetables, fruits, things like that. And so really, we should be trying to, like, when you look at your dinner plate, like, and not even dinner plate, just any plate, half of it should be some sort of like vegetable. And like, then the other half, like a quarter of that should be a protein. And then the other quarter can be a small amount of like carbohydrates. So making us rethink that sort of plate where it's like half of it is rice, and then you have a big piece of meat, and then maybe some beans, and then like it's like a small little cup of like some like lettuce. Like, no, we need
Right.
to change, we need colorful plates.
Right.
So that will also help to reduce risk. And then also looking at how much exercise we're doing. We recommend that you do 150 minutes of moderate exercise per week. So breaking that down, that's 30 minutes of exercise 5 days a week. And moderate activities could be, a brisk walk. If you like to cycle, just like a leisurely cycling, even gardening kind of qualifies as moderate exercise. And one thing, I also tell my patients, if you like to do vigorous activities, like playing like a real like pickup game of basketball or like going for a run, then you can drop that down to actually 75 minutes per week. So it's just kind
Mm.
of keeping tabs on like how much you're doing from like an activity perspective, because that's also a
Right.
help to decrease your risk of heart disease. And then one last thing is, once again, knowing, the health status of your family members and sharing that with your doctor, because then they can adjust their risk assessment of you, and they may be more likely to kind of not send you for, but like work up a certain complaint that you have,
Right.
because, maybe two of your siblings have like heart palpitations and they actually have atrial fibrillation, so your doctor may
Mm.
be more likely to like really investigate for that if you come in complaining of heart fluttering.
That's awesome. This has been great, and I hope people have heard everything we've said, and they're gonna go to their doctor. They're gonna know what their blood pressure is. They're going to know what their lipid panel is, basically your
Hmm.
cholesterol. Knowing all that, they're gonna stop eating so much salt and Maggie and Lori. They're gonna exercise and all that stuff. So I really appreciate you coming to talk on the show today. But before we go, I
Hmm.
always ask all my Afropolitan Health guests these questions. So the first one I have for you is, what is one pearl that is important about cardiology and you think can save a person's life? What is one thing? If they could pick anything from the show, what is the one thing you want them to pick?
um, if you're having severe chest pain, you need to go to the hospital. You can't just lie down and sleep through it. You need to come in and you need to get checked out.
I agree.
Because if we're
What is
able to diagnose that heart attack, the likelihood of you doing well is high.
so what is one thing you were shocked about when you learned or when you became a physician or when you got into your specialty? Like one thing you learned that you're like,
Wait,
huh?
what was a little shocking to me, the amount of people that like have had heart attacks and who still
Mhm.
smoke cigarettes, you know?
Oh my
Yeah.
God.
And it's just like and it's just crazy how addictive this substance is. How and even though we try to like dissuade people from smoking, like with increased like prices on cigarettes, it's not really working. Like there have been times when I've come into clinic to start up seeing patient, and like I share a space with a bunch of other like cardiologists, so it's a lot of patients. And the smell of tobacco that will be coming from the waiting room.
Oh
And it's
my
like, wow,
goodness.
crazy how strongly addictive this substance is, because I
Okay.
have quite a few people who start smoking again.
Wow. Yeah, we need to really, really educate our young ones. Don't even start it because it's so
Yeah,
much
don't.
harder to quit. Oh my, I cannot believe that. I see kids, so I don't see that as much. So even though I believe that's probably the case, that's quite shocking for me to hear as well. Okay, so how do you balance life as a physician, very busy, and still have a life to be with your husband and your baby? Like, how are you able to do everything? Bringing it back to LollieTasking.
So I think one of the helpful things is we have a nanny. So
Oh,
that's super
thank
helpful.
God.
Um, because like, at first we had considered like doing daycare, but like the drop-offs and the pickups, that would have been a lot. Because me and my husband, we both work long hours. So like we made the sacrifice to get a nanny. So that's key for helping with the baby. Two, it's also kind of like realizing that with the type of work that we do, that is never really done, right? Like I could be in the
Right,
office like for 24 hours and there's still something else that I needed to do. So just
right.
setting limits and being like, these are the top tasks that I need to do for the day. And I'll get to the other ones eventually.
Hmm.
And just saying like I have to leave at this time because I want to see my baby before he goes to sleep, and I also need a few like an hour or two for myself. And I think another thing that's important, is also having a bedtime for the baby so that he can go to sleep at a certain time. And so then you can have a little peace and quiet in the house,
I agree.
to not even just get stuff done, but just to like be in a quiet environment and just like relax a bit before you have to go to sleep and
Distress.
start. Exactly, to
Yeah.
de-stress and do it however you want. If that's like you want to watch a TV show, read a book, or just like lie down on bed and just like daydream. I'm totally for it.
It
And I
is
think everyone
totally
needs that.
okay to do nothing. Like, seriously, you
Exactly,
literally can
exactly.
just chill, and that is perfectly fine.
Yeah.
Okay, we're gonna finalize with this. What is your favorite quote?
So my favorite quote is well-behaved women rarely make history. And to me, it just means, that women have to disrupt the status quo, especially us Black women in medicine, because we really need to bring a focus to the health issues affecting Black women. Like, as you know, I think more people are starting to know, like, we're highest at risk for maternal mortality. We're
Mhm.
high risk for heart disease. Um, and all of these things, like, I mean, as the research is coming, there are connections between heart disease and maternal mortality, and we need to
Right.
really examine that. And so, like, why I like that quote is kind of, it inspires me that, I don't just need to go with what the status quo is and just kind of like think of heart disease as a disease that really only affects men. Um, I need to like really push myself to really bring awareness to how it also affects women, especially Black women and other women
Exactly.
of color.
Exactly. I love that quote so much, and I totally love the how you look at it, because a lot of times when people put that out there, when I read that quote, people tend to look at the negative aspect of it, but it's really just pushing
Yeah.
boundaries. And I think that's part of why I created Afropolitan Health, and that's part of why I created LollieTasking too. Like, we need to push boundaries to help empower women and get to where we need to get to. So I
Hmm.
totally appreciate you coming today. It's been so great. Thank you so much for coming. I
Thank
appreciate
you.
your insights and your inputs. Is there anything else you wanted to say before we round up?
I just want to say thank you so much for having me on the show. And I enjoyed our conversation.
Yay. Do you mind telling them how to get in touch with you in case they wanted to?
Sure. So I'm on Instagram at Dr. Tracy K. Paul. I also have a Twitter account, Dr. Tracy K. Paul,
Nice.
and you can direct message me through that.
Perfect. Thank you, Dr. Paul, again for your insight on this topic. Thank you, Lolly Taskers, for joining us on another inspiring episode of Lolly Tasking. We will have all of Dr. Tracy Paul's information in our show notes below. Again, you can also check it out on our website at www.lollytasking.com. If you want to be empowered by daily health tips, also don't forget to follow us at Afropolitan Health on Instagram. And definitely don't forget to follow us also on our LollieTasking Instagram page. Till next time, remember, you can do it too with some planning, a little bit of balance, and a dash of determination. Have a good one.
Thanks for hanging out with us on another inspiring episode of LollieTasking. If you have any questions or topics you would like for us to discuss, please contact me via LollieTasking.com, or better yet, you could just send me a direct message on Instagram at LollieTasker. If you've liked what you've heard today, what are you waiting on? Just go ahead and click that subscribe button, rate and leave a great review on iTunes. And of course, do share with your friends. Till next time, this is LollieTasking.